Welcome to our monthly webinar. My name's Jackie Jacob. I am the coordinator for the small and backyard flocks community of practice here on E-Extension. I'm at the University of Kentucky. I do the monthly webinars, and this month's webinar is, you can start sharing your screen, Mickey.
All right.
This month's webinar is on working with your diagnostic lab. If you have any concerns of poultry disease, the best way to get it diagnosed, of course, is in a laboratory. And Dr. Mickey Hall, who is in post-retirement at Clemson University, is a small flock specialist, and she's gonna come here to help us discuss submitting birds to a diagnostic lab. I will be on mute, but I will be monitoring the question and answer and chat panel. So if anybody has any questions, just type it in the box and I'll make sure that they get answered. All yours, Mickey.
All right. Thanks, Jackie. I appreciate it. Yeah, today I'm going to be speaking about submitting birds to a diagnostic laboratory. Now, with that, said, every state runs their diagnostic laboratory just a little bit different. Jackie shared in Kentucky, they have 2 diagnostic labs. In South Carolina, we have 1. Georgia has multiple diagnostic labs. So some states have more than 1 depending on the size. Also, depending on whether they have a large bird industry or large small flocks, the number of diagnostic labs will vary. I wanted to start out with talking a little bit about, a health management suggestion, and how do we know, when we're going to submit a bird to the diagnostic lab. Obviously, if it had died, that would be a good time. But what are some health management suggestions to make sure that our birds are healthy, or when we start to notice that our chickens are not, or our birds are not feeling well? So I always say, please observe your birds, or really any animal that you keep, at least twice a day. You should know what their normal behaviors are, how they, if they're free range or in a coop, it doesn't matter, but you should observe how they interact with their flock, with the other birds around. I like to look at their poop, and that really tells me a lot about how the bird is feeling. They obviously can't tell me personally. I'm not a chicken whisperer, so they don't tell me how they feel. But I can look at their poop, and the best place to do that is birds before they get off the roost in the morning and get down. They usually poop, and so that will be underneath their roost. So that would be a good time to check to see how they're feeling. Birds like to empty what we call their cecal pouches, which are towards the end of their intestinal tract. And obviously, I have 2 pictures up here. One, you can see that the poop is rather runny. It does have some round worms in it. That could indicate, why is that bird so droopy? That's not the normal consistency of chicken poop. And the other picture shows a nice, healthy, plop of chicken poop, so to speak, with looks like they had plenty of protein. That white is a result of protein metabolism or the digestion of their protein. We can look for the parasites, as I said, with worms. There's also looking for blood, possibly in their poop as well. So, get some indication as to when this bird is feeling poorly. You'll also see if you are raising egg producers, oftentimes the production of eggs will stop. You'll see birds usually like to isolate them. If you have more than one chicken or a group of chickens, a flock, they'll isolate themselves from the rest of the birds. Do you pick your birds up? Occasionally. A lot of times I get calls where people say, oh, they're just big and fluffy. And I said, have you picked them up? And they say, well, no. And we'll get them at the diagnostic lab and they'll be skin and bone. But what they've done is, fluffed up their feathers. They made themselves look much healthier than they are and fatter than they are. So they won't get picked on by the other members of their flock, or possibly become a prey, because we have to remember everything likes chicken, and if a chicken shows its weakness, then we know that if they show that they're weak, they can't fight back, then they'll get picked on even more. So when we see that sick bird, what's going to be our first response? The other thing about sick birds is oftentimes by the time we see a bird that has isolated itself, looks droopy, that bird has been sick for a while. Birds, as I said, like to hide that they're not feeling well so they don't get picked on, they don't become prey. So we want to take that bird and isolate it from the rest of the flock in case you have, it's contagious. No beak-to-beak contact with other birds. Place it in a nice draft-free, doesn't necessarily need additional heat, especially in the summertime, but a draft-free environment so it won't get, chilled. Have fresh feed and water, placed for that sick bird. At that point, you can pick it up and check the bird for any external parasites. Does it have an injury? And just look at it, from, a personal perspective. So what happens when, our birds die? And in the picture there, you can see a little Buff Orpington. She's isolated. She's acting like, she's all puffed out. Buff Orpingtons are big birds anyway, but she was basically very thin. She was trying to pretend, that she wasn't sick at all. So if we get sudden or unexpected, death of one or more of our birds, and it wasn't due to old age, then we want to submit a bird to the diagnostic lab to find out, exactly what happened to that bird. If it's something contagious, and that's why I said we always need to isolate those birds away from the rest of the flock so that the rest of the flock doesn't get the disease. But, we just basically, don't want them to get picked on. So when the bird, as I said, starts to look puffy, it kind of extends its wings from its body, looks all fluffed up. It has what we call, it just ain't doing right. It's not, as I said, in the flock, then it's probably, has issues. So when a bird or several birds die, we need to know, why did it become sick? What's happening with the rest of the flock? We want to submit a bird to the diagnostic lab so that we can have tests done on that by a poultry veterinarian or, other poultry professional, so that we can prevent any further health issues, especially if it is, something that we can do management-wise and improve that bird's living situation. So submitting a sample. If you're raising breeder birds and you're suddenly getting a very poor hatch, some diagnostic labs will take hatching eggs and examine those, try to determine at what stage of the embryological development the embryo was at. They'll also do cultures for bacteria and for viruses to make sure that, see if that is what the cause of the disease is. If you have a dead bird, that needs to be submitted to a diagnostic lab. If a bird is showing, it's sick and it doesn't look like it's going to recover, and look at your other birds that don't seem to be as ill. They don't seem to be showing signs of disease. For our diagnostic lab, probably the best sample is a bird that has just recently died, very fresh, not been frozen. If you have a bird that is already sick, and one that perhaps is not showing signs yet, that gives the diagnostician an excellent sample to pull blood from those live or sick birds so that they can look for particularly virus and bacteria. Viruses oftentimes start in a bird system. They'll linger for, say, 10 to 14 days. And oftentimes by the time you get a bird that's dead, the virus has cleared out of the bird's body, and then we see a large number of bacteria growing in the bird. Well, is it really the bacteria that caused the problem, or was there something occurring like a virus before then? So being able to pull a blood sample from a bird and then humanely euthanizing it, will help the veterinary pathologist do a better job. The veterinary pathologist can also look at their, observe their behavior. They can also examine them for any external parasites. Is there any injury in this bird? They can also, both on dead birds and your sick or live birds, they can do swabs for particular diseases so that they, again, can get a better idea of what is going on with this bird. Because, again, they have a bird that's not really going to tell them what's going on, just like all our animals. Since this is somewhat of a generic, not all diagnostic labs receive live birds or sick birds. The best thing is to call the lab and find out or go on their website to find out exactly what is the best way to submit a bird. Can you bring a live bird so that they can pull blood? Do they only take sick birds? The other thing is some diagnostic labs only receive live birds on particular days, say Monday and Thursday and Friday or something. They only will receive birds before a specific time of day. So it's always good to get in touch with the diagnostic lab in your state before you send a bird or before you bring a bird to the diagnostic lab. And live or sick birds must be hand delivered. You cannot send them in the mail. You cannot ship them. Some states, obviously you cannot ship a live bird via UPS or FedEx or the U.S. Postal Service. They don't want to have that. So check with your diagnostic lab, find out what is the best way, the best sample for them to receive. And if you're handling dead birds, be very careful. Birds have bacteria. We can pick up that bacteria from those dead birds, be careful when handling them. Pick them up with a plastic bag or with gloves. Do not pick them up with your bare hands. Oftentimes, if you are going to ship a dead bird to the lab, place paper towels under the bird's body. This helps to absorb any excess fluid, especially if you're going to be shipping that bird to the lab. What you want to do is get that bird, get it cool, but do not freeze it, okay? Oftentimes, if someone freezes a bird, puts it in the freezer, and then submits it, a lot of times some of the slides that they make, the tissues will be damaged from the freezing, and they won't be able to get a good diagnosis from that. Always double bag the bird and place it in a disposable cooler. You do not want that cooler to come back to your house or to your farm. Use ice packs to keep that bird cool but not frozen. And then you're going to have to provide information about the bird. And oftentimes, as I said, if you've called the lab beforehand, they're expecting that sample. They're ready for it. So they would like as much information as possible about that bird. For example, with South Carolina, which I'm most familiar with, we have our submission form online, and I would probably gather that most diagnostic labs do the same thing. They have a submission form for your bird online. And some of the information that they're looking for, if they don't have an online, is the owner's name, the complete mailing address where this bird is located, phone numbers, email address, any way that they can get in contact with you. Let them know what the bird breed is. Again, if it's a mixed breed, that's perfectly fine. What's the age of this bird? Oftentimes there are certain diseases that affect birds when they're very, very young versus older. What's the gender of this bird? I mean, if it's a very young, if it's day-old chicks or week-old chicks and you don't know the gender, that's all right. They'll be posting that bird. They will know the gender after they do necropsy. The other thing is, let the veterinary diagnostician know what have you been observing about this bird's condition. What are the specifics of that condition? How long has this been going on? Did you try any therapeutic methods to try to treat the bird? Did you use any analgesics for pain? Did you try to give it vitamin supplementation? They need to know exactly what has been tried with this particular bird. Did you take it to another veterinarian? Did they use the antibiotics on the bird? They need to know what antibiotics, if the other veterinarian had seen the bird, had been used. What type of feed is this bird eating? And as I said, include any supplements. Are you feeding mealworms? Are you, feeding other types of supplements? The other thing when we're observing birds with regard to, illness, was the bird eating or drinking? You should be able to, see that in the bird, as it is getting sick or going down. Like I said, pick that bird up. Is it feeling very thin? Can you really feel that keel bone? Obviously, it hasn't been eating or drinking anything. Are you starting to see in the comb and wattles area, is it kind of blue? So they haven't had an opportunity to do much drinking. This is all very important. Bird housing, are these birds running, are they on a free range, or, are they cooped up? what's their housing, situation. And as I said, if you observe this bird for a while and you've already isolated it, from the other birds, that's, excellent. So the more information you can provide to the veterinary pathologist at the lab, the better, they will know exactly, what to be looking for. And oftentimes our veterinarians say, there's very few diseases, people will say, oh, the bird's kind of droopy, it's thin, that could be one of 1,000 diseases in poultry. So the more specific information you can give about this bird and its condition, the better off you will be. What date did you get the sample? If it's a whole bird, what time of day was it collected? What's the size of your flock? Is this one of 5 birds, or is this one of 500? Or oftentimes with bird submissions, they consider, anywhere from 1 to 10 birds a single submission. The more they can look at different birds, the better off, as I said, they are. How many sick birds are you getting, in your particular flock? And here's a very important, it's important to get those birds to the diagnostic lab as soon as possible. As I said, do not take that bird, put it in the freezer for a week, and then bring it out and go, oh yeah, I need to, send this to the diagnostic lab. As I said, the tissues get damaged from freezing that bird, and but keep the bird cool in plastic bags, and bring it to the bird as soon as possible. Again, check with the lab, make sure it's open. Don't go there at 6 o'clock on a Friday and expect to see a lab full of people ready to take your sample. So bring the birds directly to the lab, let them know you're coming. Some labs like ours have people there to receive birds on a Saturday, but only till like 1 o'clock in the afternoon. They will have someone there to receive birds in the early evening up to 6 o'clock. But there again, the diagnosticians, the lab is technically closed. Some labs allow you to overnight express mail the dead birds, that have been placed in a double plastic bag in a disposable cooler on ice packs, can be sent overnight. Please check the mailing address and the UPS or FedEx address. At our lab in South Carolina, the reason I know this is they have a separate mailing address, and the UPS and FedEx address are different. The UPS and FedEx trucks come directly to the lab. The mailing goes to a post office box. And that's why it's important when you're bagging up your dead birds and putting them in a disposable cooler on ice, and that have paper towels under that bird, that the U.S. Postal Service isn't receiving a leaking wet package. Chances are they probably won't deliver it to the diagnostic lab. So if you take it or if you send it, again, follow up. Make sure someone has received your sample of birds, or that someone is there to receive your birds. Again, I can't emphasize enough to call ahead, let the diagnostic lab know you're coming, you're bringing samples. Will someone be there to receive it? So extremely important. Good communication helps give a good diagnostic. So when the birds are at the lab, they're going to undergo necropsy. If you brought live birds or sick birds to the lab, as I said, the diagnostician has an opportunity to pull blood. They can get more samples from that. If it is if the bird, if they've gotten those samples, swab samples from dead or live birds, they can do a excellent job at necropsy. And necropsy is basically an animal autopsy. And so your bird, even if you brought it live to the diagnostic lab or sick to the diagnostic lab, it is not going home from the diagnostic lab. That's extremely important. Those birds will be, if they aren't dead already, will be humanely euthanized, and necropsy will be done. Here again, in terms of cost, every diagnostic lab is different. The cost for necropsy and diagnostics vary from state to state, so I'm not going to go in to that. Our current rate, here in South Carolina, we have to charge to cover the cost of the different laboratory tests that we're doing. So it usually runs $90 for anywhere from 1 to 4 or 5 birds. So, but that's not $90 each. That's for your sample. And obviously, depending on what type of animal is brought to the diagnostic lab, because they do also more than just chickens and turkeys and ducks and geese and other poultry, the cost varies with the animal. There will be specific diagnostic testing included with your fee. All labs are always checking for avian influenza. They will culture for that. They will do a test called polymerase chain reaction, PCR, for avian influenza. They're always looking for that, even though your bird may not have the signs or symptoms of that particular disease, but it's one that's very critical to the poultry industry. In some cases, some tests, the lab is not capable of doing every single diagnostic lab test out there. They may have to ship a test to another diagnostic lab. For example, we ship some blood samples to the Georgia poultry lab to do further testing for Salmonella pylori or Salmonella gallinarum, pylori and typhoid. So that we have to pay for. We don't get that free from the Georgia poultry lab. So there sometimes may be extra costs involved. So know that. And here again, that communication with the laboratory before you bring that sample, to the lab, and what tests will be done, good communication, you will know exactly what is, going on. You won't be surprised, if they say, well, this is going to be $90. Some people won't pay $90 to have complete diagnostics done on a chicken, So again, good communication with your diagnostic lab. Some of the veterinary diagnostic tests, and this is when they do necropsy, they're going to open up that bird. They're going to culture all the organs. If they had an opportunity to pull blood, they'll do serology. They'll do PCR, polymerase chain reaction, looking for certain viruses, and there they can get very specific as to the genetics of that particular virus. They'll do histopathology, where they're going to make tissue samples, examine all of those samples from every single one of the organs in the bird's body, the lungs, the heart, liver, kidneys, body cavity, the intestines. They'll be looking, taking samples, making slides, looking to see the histopathology. They'll be doing microbiology, culturing for bacteria, fungi, mycoplasma. These are very important tests. Along with that microbiology, when they are culturing, they're also going to find out what antibiotics would, if they culture and find a bacteria, they will also do an antibiotic sensitivity test to determine which antibiotic would work best on the bacteria that they cultured from that particular bird. So they will look at that and determine, you know, when they make their diagnostic evaluation, they'll let you know exactly what particular, you know, antibiotic will work the best. As I said, if the bird was brought in sick and they could get some blood work, or the bird was didn't appear to be that ill, they can pull blood and look for antibodies to other common poultry disease. I mentioned the molecular, the PCR on tissues or blood. Here they're looking at genetic material. Avian influenza is one that we do PCR on, polymerase chain reaction, molecular work on. These are new and tests that can be read within 4 hours. So also very good. Parasitology. They'll swab, they'll look at the feces for parasite eggs, or look at the poop and actually be able to see if there's roundworms or any other kind of parasite in there. They're going to isolate, do virology, isolate viruses from different tissues. Again, with fluid smears, they can do the cytology, examine those microscopically. So they are looking at they're looking at the bird in all different, at all different levels. And as I said, they should be able to make somewhat of a good diagnosis if they have a good sample. And that's the important part. So the diagnostic results, most of the time they'll have most of these within a 3 to 7 day period. Some samples, like salmonella, as it says, can take up to 2 weeks, depending if they are actually looking at the specific type of salmonella. Here again, when you get the diagnostic results will depend on specifically what tests they were done. Our lab and other labs send the results. The accession report is what it's called, are sent to the owner via email. Oftentimes, if someone from, like myself, gets notified that this person has sick birds, and they may want management suggestions made, they'll send me the results as well, so that I can look at them and interpret them, because oftentimes the veterinary pathologist will use these gigantic words, and you don't really know exactly what they're saying. So it's important to have someone help interpret these results, so you know, as a flock owner, how to deal with this with regard to management. As I said, I get results sent to me so that we can make management suggestions in order to help improve your flock, to help improve your management techniques with your birds. It might be something, you know, some very simple type of, reaction that we'll have to, make, but it should be, you should try to get as much help and understanding of these results as you possibly can. So with that, I'll take any questions that you have. It's, as I said, this has been somewhat general because of the fact that every diagnostic lab in every state is somewhat different. So as I said, knowing where and the contact information for each of your diagnostic labs is an extremely important health management tool for you. Okay.
Jackie, your lips are moving, but we cannot hear you.
That is correct.
Can you hear me now?
We can hear you now.
I keep leaning on that and turning it off. It's important to know ahead of time because, like, Kentucky only takes dead birds,
Okay.
and they require that they come through through a veterinarian.
Okay.
They don't like people to show up with it. They want veterinarians. And of course, very few veterinarians do poultry, so which makes it difficult. But if you call the diagnostic lab, they'll usually work with you to whatever state it is that they're going to work with you to get it out. So do either of you have a question? We have a few minutes. While you're thinking of questions, I'll let you know that September's webinar will be on poultry diseases that can be spread to humans. October is backyard poultry zoning regulations, working with your local authorities. November is an overview of chicken anatomy, and December is feeding a small and backyard poultry flock. So we have some interesting ones going through to the end of the year. Hopefully you'll find one of them to your liking and join us again. I'm not seeing any questions. I don't see anybody typing anything. So thank you very much, Mickey. You did a great job. It's hard to cover when each state is
A little bit different.
so different. Yeah. So
we do, and here in South Carolina, we do take live birds. In fact, that's Dr. Helm, and they prefer if you have one that is, somewhat sick, one that's a little bit healthier, and one that's already gone. That's their best sample. They say they can get more information from that. So we do take live birds, but they don't come back to you.
no, that's important to remember.
Right. They're, the old joke about the guy that brought the 4 birds to the diagnostic lab to, find out what was the matter with them. And they did an necropsy on all 4. And then he said, well, I'm here to pick up my birds. And they said, well, they're all gone, and the guy, he said, well, that was my whole flock. It's like, well, not anymore. So they don't return. So anyway, but
okay. Well, thank you very much. Thank you, Mark.
Thanks, Mark. I appreciate it again.
Yep.
Okay. See you in September.
All right.
Thanks.
Bye.
Bye.
Bye.